Hi, I'm Jessica. I'm getting an eyebrow transplant. When I was in high school, I didn't like my brows. I didn't have enough hair. So I found out about, microblading and like the tattoos. So I did that. And I was unhappy about it. I didn't like how they looked. And I saw Dr. Sean, his work on YouTube. And yeah, I kept scrolling and going through each video and just liking the results. So I decided to just go for it. I'm excited of like how natural they're gonna look because I've seen the other patients, the outcome, and they look fluffy and thick, and that's what I want. I'm tired of filling them in and trying to make them look natural. Even with makeup, they look harsh because they're already tattooed, so they look very harsh, and I don't want that anymore.
Hi, this is Dr. Sean Behnam and I'm joined with our patient today. Thanks so much for joining us. And today we are performing eyebrow hair transplant where we will be getting the hairs from the back of the scalp and putting on eyebrows. So she had her eyebrows tattooed about 3 times. So now we're going to put actual hair into the tattoos itself to make it look natural. Now remember, eyebrow hair restoration is very unique. Right, is unlike any other hair transplant. So whoever that does it has to have a lot of experience in doing it. When someone has a tattoo, the entire configuration of the grafts must be different. The technique, the methods in order to get that good graft survivability. Should we get started?
Yes.
Wonderful, let's get started. For the most part, your the whole design is very similar on both sides. So the design is really important. Design is key. So over here, this was slightly lower, so I just brought it up a bit. Now let's go down the center here. So I would not do this. This is just fine. It goes from here to here and from here. If you have that red tattoo there, I would not go in there. It's not symmetric. I mean, you don't want it to be symmetric anyways, but okay, perfect. Come closer to me, please. So these are good. I mean, you can't really go. I'm gonna try to see if I could put some here as well, but I'm not sure because you're gonna cause shock loss. Here as well, I think on this eyebrow, we start from here and I go all the way to here. And on this eyebrow, right, over here a bit, and then basically just go down there. What do you think?
Yeah.
Right? Because if I could see there's room here, I'd put it, but so far it doesn't. But again, there's tattoos, so I may not be able to see. If I could put some, I'll be able to do it. Now, you have eyebrow difference. This eyebrow goes up, this eyebrow goes this way. I have to follow this angle. Right? I mean, I think at the end of the day, it doesn't really make a difference. we are here at the end of the day. We did 300 grafts on each eyebrow that we placed. So, how was your day?
It was great.
Excellent. So, are you ready to look at it now?
Yes, I am.
Perfect. Here we go.
Oh my god. They look amazing. They're thick. Just how I wanted them. Yes. I love them. Thank you.
Perfect. So now you just gotta take care of it.
Yes.
You know, just remember the eyebrows, right? They're gonna fall out in 1 month and they're gonna regrow back in about 4 to 5 months. So perfect. So just gotta go home and take care of them. Wonderful.
Thank
you did
you.
great.
Thank you. I was a bit nervous, but I felt very well taken care of with Dr. Sean and his assistants, and I can't wait, you know, later on how they look afterwards. But yeah, but right now I love how they look. They're thick, just how I wanted them. Very happy. Thank you. So I'm very excited in the future when I go out with my girlfriends, and I'm gonna have full brows. They're gonna be natural. They're not gonna look tattooed on anymore. And yeah, definitely a lot more self-confident. Yes. If someone wants to get it and they're not really sure, I would definitely say do it. It's a well investment, and you know they're gonna keep growing. So that's one of the good pros of getting a brow transplant. It was, in the morning, and they gave me some snacks, and I feel very well taken care of. You know, they asked me if I wanted a blanket, and yeah, then they started, and at all times they asked me how I was doing. Yeah, and it felt nice that they were very they were concerned about me and always asking me how I was and if it hurt it or not. And then later I had lunch, and then I got to use the restroom when I wanted to. And yeah, and then afterwards it was done. Yeah. Hi, this is day 2. I'm feeling great, I'm well rested. It went well yesterday. Got home, rested. Now I woke up, I'm feeling great, no pain. Yesterday night, Dr. Sean contacted me, wanting to know how I was feeling, and I felt very well taken care of, that he's concerned, and yeah, he checked up on me. Yeah, and today I'm here. I feel great. I'm very excited for the future because this is what I wanted. I didn't know about this kind of procedure, and now that I got it, I'm very excited how it's gonna look afterwards. I know it's gonna look even better. Right now I'm a bit puffy, but that's fine. That's part of it. And yeah, I'm excited how it's gonna look. If they're overwhelmed about this procedure, I would say to just do it. Just do it. It's definitely worth it. Instead of getting tattooed on or something, definitely it's like a lifetime kind of thing.